A local doctor unveils a new product that might unlock the mystery of your pain and suffering and make you well when everything else has failed. Is it a miracle cure? No, but really, it may be a medical breakthrough.
Well, it's called the Alpha Stim, and it's being used to treat patients with illnesses really seriously here that range from migraines to fibromyalgia and depression. Stephen Cooper has more.
Jim Smith sure knows how to handle the guitar. Oh, but those hands. When those hands don't work, he can hardly handle anything.
I was getting a lot of numbness and tingling in my hands and my wrists, on up to my elbows.
What he gets is carpal tunnel syndrome, a crippling-like grip on his hands which has a way of silencing his music.
I was very willing to try whatever it took to get past the carpal tunnel.
And so he tried acupuncture here at the Titusville office of Dr. Anita Spitz, and it seemed to work. Then the doctor hooked him up to the Alpha Stim.
I had not had a flare-up of carpal a good year and a half, 2 years.
So the Alpha Stim works, but what the heck is it? It's based on microcurrent electrical therapy.
It's electrical medicine.
The Alpha Stim works by moving electrons through the body and brain at a variety of frequencies, collectively known as harmonic resonance.
You make it sound like our bodies need electricity.
Yeah, they do, actually. All of our cells are fire with electricity all the time. That's what the sodium is, a positive, and your potassium and your chloride's a negative.
Okay, here's an analogy. The Alpha Stim realigns the electricity in your body like chiropractic care is believed to realign your body's skeletal infrastructure. And studies show it is an effective treatment for many kinds of ills, for depression, anxiety, TMJ, fibromyalgia, and for the kind of migraines that Elizabeth Kanigaris suffers.
One migraine headache could last 2 or 3 days.
No, she's not listening to music on an MP3 player. She's wearing the Alpha Stim ear clips, which is one mode of getting the electrical charge to the brain. We'll show you another mode in a moment.
It really works. I used it for about 3 weeks.
The device is believed to have a residual cumulative effect, which may explain why this is Elizabeth's first session with it in a year, and why she's been able to go 4 or 5 months migraine-free. In my case, Dr. Spitz wants to use the probes and the ear clips. The probes to target the exact area of my pain, the result of a bad car accident years ago, and the clips to send my brain an overall electrical message of wellness. And more importantly, to extend the benefits of the probes.
It's a microelectric current, and it's extremely low levels of electricity, so you don't have to worry about. The biggest side effect is possibly could make you dizzy if you turned it up too high.
Well, I did have it up too high and got a little dizzy, more dizzy than some people think I usually am. But I had an overall sense of well-being, and it relieved the sciatica pain for several days. And Dr. Spitz has used the device for almost 4 years on hundreds of patients and says she's had an 80 to 90% success rate. She also says the Alpha Stim, when used for depression or anxiety, performs just as well in head-to-head studies as the popular medications Prozac and Zoloft. Once you see a doctor, you can purchase the unit for about $500, but it may be a challenge to get insurance to pay for it. How about that, Bob and Lauren?
All right, Stephen, a lot of people scrambling for that.